I'm Dr. Miner, and I am going to demonstrate how I use a diode to address myofascial pain, TMD issues, and what I do is I have my hygienist here, and all of us dentist hygienists are going to get muscle aches from what we do, and she has a little bit of soreness here in her jaw, and I am going to use this is just like a makeup marker. And I prefer to use a light color marker because with a diode, the more pigment there is, the more the laser is going to get absorbed in that dot. And so I'm going to feel here, feel around. Feel anything there?
Mm-hmm. That's worse though.
That's worse. So I'm just going to put a dot here. And then what about here?
Mm-hmm.
Is that worse? Or in that area? Or
equally. That's bad.
Is that sore?
Mm-hmm.
Or is that worse?
That's worse.
That's worse? Okay, what about over here? Not as bad?
That's about just as bad. That's worse.
Right there? Okay. I'll put a dot there. So if you turn your head, those are our two dots, and that's the areas we want to address. So in delivering the laser energy, this is a bit more complicated. This is where your 8th grade math comes into play, because we have to determine our area, work with our spot size, which is our power density, and we have to calculate the dose. We have to determine whether we are wanting to stimulate healing or we want to reduce pain. Those are going to be two different doses that we do, and in this case we want to address pain. And so that's typically a higher level energy level. So we're going to do more joules with that. And we have some pretty localized areas here where I'm going to be using a pain therapy handpiece. I'm going to be using a small spot size on these areas. So we come in here. Sometimes I'll even take this off and we'll go direct contact right with the skin. It just depends on what's going on with the patient. So I have this set at 4 watts, which is the default setting on the Epic. And this will probably feel a little warm. And I am just going to hold it here. And if it starts to get too warm, she can raise her hand. And I'll either stop or I'll just move it around. And I'll keep doing this until I deliver the amount of joules we want for that area. If this gets too warm, since these are close together, I can just switch up here to that one, let that one cool off, and we can just go back and forth. And this type of laser energy can be addressed, all over the neck and shoulders, the jaw, the joint. It works great for the actual joint pain, and when there's trauma in the joint to help reduce that inflammation. Very beneficial.